The aScope Gastro is 100% sterile, so I can open it up on the entire sterile field and place it wherever I'm interested in. I can't do that with a regular endoscope because it is not a peel-packed, single-use sterile instrument. So the setup for an aScope Gastro is remarkably simple. I do not require an endoscopy nurse. I do not require a separate laparoscopic tower to set that instrument up. With the availability of the aScope Gastro and aBox 2, we are able to have additional operations placed in a day for multiple surgeons who all do endoscopy. We are able to do thoracic operations, abdominal operations, bariatric operations simultaneously without any additional delays, and we can often get extra procedures done where we're never limited because we are unable to have an endoscope readily available or cleaned and brought up to the room. The other critical aspect of an aScope Gastro is I can do what I want to it in the operating room. I can burn, suture, cauterize, damage it. No one's going to be upset at the expensive instrument that just got damaged. With the aScope Gastro, it's done at the end of the procedure, so I'm really able to do what I want with it.